My name is Deborah, and I live in California and Liberia.
My name is Deborah. I live in Liberia.
I'm so glad to be in Liberia with you, Deborah. So, in Ebola crisis, we didn't get to see each other, did we? We could talk on the phone, right?
Yes.
But we couldn't see each other. What happened? What happened to you in Ebola? Could you go to school?
No.
So what'd you do all day? What'd you do all day?
I just stayed to my house.
My name is I'm a physician assistant and an Ebola survivor, and now I'm president of the Ebola Survivors Association of Liberia. I actually contracted this virus at my workplace at the Redemption Hospital, where I was assigned on duty, and I remember at one point in time caring for one of my colleagues, that was a nurse. But basically at the time of my own interaction with her, she just complained of weakness, and this was the early part of the outbreak, sometime in June, and I didn't really, know that she had the virus, and so I did some physical examination of her and admitted her on a short stay. After a day or two, she died, and her specimen was taken and carried to the lab. It came back positive of Ebola.
This is how I felt. It was for those brave men and women that stood in defense of this country. Because by then, we had dead bodies all over the place. And if you're not brave, you couldn't be there. It was like you seeing death and you're walking towards death. But you're doing it because of your brother and sister. I think the going home would not allow your effort to go in vain. You did well. No man can pay, but he's going to reward you.
I'm the center manager for Mount Barclay, Onole Foundation for Women. And I'm Water SB Gator. And we bless God that we are alive today. After a long stress, frustration, and losing of family members, today we are counting among the living. We appreciate God for that. And at the time of Ebola in Liberia, it was so stressful, especially so on the land of the business. It was so hard. Nobody could trust one another. So you don't know who is who. The virus can attack anybody, so it was so stressful. At the final analysis, there were no capital. People couldn't buy that much because people were afraid. Even to receive money for customers, you have fear.
My parents died from Ebola, but my father contracted the disease from Douala. Brought it in the house, and then my mother, the one that taking care of my pa. After 1 or 2 days, 1 week, she came down with the virus. And before that, my nephew died. My mother too followed.
When that name is called Ebola, it brings fear and it brings alienation, and nobody wants to be associated with anyone that is called by that name. And it was deadly. It brought complete separation Nobody wants to even come closer to a family that is even noticed of being called by that name, Ebola or survivor or Ebola patient. You know, so that was too difficult.
Even the people used to go in the rubber bush for wood, they couldn't go there again. You know, like it was the time the youth in Mount Barclay, you know, they put themselves together to start mining the graveyard so they can just bury there later. Now what helped us here, the youth really helped us. They used to bury Johnsonville and back here when you go into the plain school way, so that the youth, they want to, you know, put themselves together and stop that burial.
When Ebola first started, we was like doubting, and people was like, yes, we believe, we don't believe. But it came a time when people we were in a hotel started to leave, and people in the community started to die. And we lived right by the RY hospital, and I used to go at the Marshall place where I was having a construction site, and every day I go there, I would see by that. And we stopped going there because I was so afraid. Oh, when you get in the taxi, everybody is afraid to touch each other. And when I would leave from work and I go home, and when my son runs to me, I would say, hey, no, don't touch me. Wait until I go and take some shower, wash my hands and all. And when I get home from work, because I interact with people, we were washing our hands constantly. So when I go home and my son wants to touch me, I would say, no, don't touch me. And I would tell him, I say, you know what, your bed is separate and I have separate bed because I'm interacting with a whole lot of people.
When you had doctors and nurses running away, we decided to stay in the fight because our people were then dying. So I decided to help this family of 7, which 6 of them died, and only this little child was left. So one evening I picked up the last 3 families, and then I told the neighbors around that wash him, because if I had taken him to the ETU, he would have been tested negative. I said, wash him when he just come down with the signs and symptoms, any fever, let me know. And this fateful afternoon I was returning from the ETU, and then I was called that indeed he has dropped with sickness. And I left all that I was doing. I ran at his house, and I saw him lying in the pool of vomit, helpless. I knew exactly what was happening, so I ran in, put on my PPE hurriedly, ran in, picked him up, had him face up while I ran to the ambulance, and then he vomited on me. And I didn't really care because I was only looking at his life. Then all I felt I was well protected, and I got you on board, took him to the ETU. 2 days later, I came down with fever, and I decided to go to the ETU by myself. When I got there, indeed, I was tested positive.
Most of our parents that work with us in the schools, they come from the marketplaces. And some of them do businesses across the borders. Besides that, right now, relatives are free now to visit because they know that people are not too sick again. In some places, they never saw the severity of the disease. So now people are coming to see how the people are doing. What if they come and they have the virus that they can spread to a home? Children are getting sick and they come to school, malaria will send them right back. So I have fear. But I have hope that it's actually going to go away once we can practice the preventive measures.
Ebola has been very destructive. You think of Ebola, you think of a killer. Worse than even the machine guns, worse than a person wishing to hunt down another person, because it's really semi-invisible. It causes the trouble. The person is dead, and then you tell that this was Ebola. That is when they get more powerful, just in the body, in the dead person.
For me, when I heard about the Ebola outbreak in 2014, at that time I was in the States at the UN conference on the status of women. But when I heard about the outbreak, friends told me to stay back, and I said no, then I came back because I knew that my group, people that I represented, they needed me. So as for me, I came back home. While people were afraid to come back to Liberia, I came back to Liberia, and I had awareness going on. I had radio talk shows. I went into the slums like West Point, to those remote communities, carrying awareness for disabled person to be able to guide yourself, to take all the preventive measures, and that God could have it. For me, I've been asking how many persons with disability have been affected, but when I went into West Point and did some survey, there was no person that was affected because the society discriminated them, so they don't go around anybody. So I think that saved them.
Ebola was like a hell for us here in Liberia because we have our children stuck in-house. We have ourselves afraid to go to the market. We couldn't get to the market easily. We have food stuck in the house. Food were getting rotten. But like I said, Ebola was a hell. One of our colleagues that I know, one of my close colleagues, she didn't make it right now. And she got a lot of family. She have her friends, her mom and dad, everybody there. Like, completely out of everything. There's no food because she was like a provider for the home. My kid right now, he's not with me because of the same Ebola. He's with my mom because when I'm at work, there's no one home to take care of him. So I need my mom to take care of him because he's just 4 years old and no child of that age doesn't know much about Ebola. They don't know anything. They just go around playing here and there.
Ebola is not a strange thing to us all Liberians, and it was a headache. It was an agent of destruction, and I also call it an agent of change because it have helped Liberians to get used to something that they were now. It was not a normal thing for Liberians. They had hand washing and be very conscious of what you do in mingling with people and other things. So it destroyed, but it brought some level of change. And for students to sit for 8 to 9 months, it has carried us backward for some time for this very first period. The tax is not easy because we are reviewing and refurbishing for those who have even, because there were some children from homes that they now have the opportunity of telling them even go back to your lesson or those things. Everybody have forgotten, relaxed about the school, and now we are coming back. So the load for us as administrators and teachers is not an easy thing because you are reviewing at the same time. You want to cover out the required lesson that is planned by the Ministry of Education for the students.
Well, what is like now is that even before the border, before the whole crisis subsided as it is now, I have been appointed as a judge, and so I'm now in a court. Even though I just heard from one of my colleagues that there will be a training that will be going on in Bon County, maybe beginning tomorrow, which I'm not a part. But as soon as the country can be declared Ebola free, of course I'm hearing about April 13, which is about a few days from now. Then of course the Judicial Institute will resume normal activities and training will start again.
Finally, personally for you, your life, what was it like for your family to survive through this process? What kind of measures what is your story, your own family story about Ebola?
Initially, we did not expect Ebola in this country, so we did not really plan for it. And in our culture, how we live, we like to shake hands, we like to hug one another, we like to honor our dead, and so on and so forth. So it was very difficult for us to get accustomed to it. It is people with large family. And so it was very difficult. In fact, when school was suspended, many people did not have the idea. Personally, we had to just get adjusted to it because some of the measures that were put in place by the government, we thought at first they were bad, but we kind of realized that it was meant for our own good. And today, we are happy that even Liberia, among the 3 countries that are affected in West Africa here, especially with our neighboring country, at least we are coming out better.
I just want the people to be able to say thank you to the government of Liberia because the president tried. She even visited Benson Hospital here during this Ebola crisis. She went to so many hospitals and clinics just to encourage the health workers. And so she provided the leadership also to all the health workers. We lost many health workers during this Ebola crisis. So it was a big blow. Many of our colleagues died, doctors, and we already don't have enough. And some are dying again. So for me, it's a big blow to the country. So we have to train more people and to tell those people that they have done well to the country. We appreciate them and we remember to help their families also, because they are the breadwinners. Some of them are the breadwinners for their families.
Today we are unfolding a unique process that will enable us to chronicle not only the already notable names that stand out there, the heroes of Ebola war, but also everyday Liberians who night and day man the ETUs throughout this country. And so, creatively fashioned by Feed the Future partnership and fully endorsed and supported by us, this government, this process will translate into the most honorable and deep-felt expression of gratitude to those who today have thrown Ebola in full retreat.
I got nothing to talk.
You have nothing else to say about Ebola? Are you just glad it's over?
Yes.
Okay. You're very brave, Deborah. I thank you for talking to me about Ebola. And may Ebola be gone forever. We pray for that, right?
Yes.
Okay, we pray for that. Okay, God bless you.